Hey, I'm here with Dr. Robert Laidlaw, the founder of Secure Health Chain. Robert, what's got you excited these days?
Look, I'm really excited about digital health. I think digital health is going to be the future, and we're only just sort of brushing the surface of what's possible.
Tell me more. What about digital health? What's so exciting?
I think that with data is going to be central to everything that healthcare relies on in the future. I think it's no secret that healthcare is on a bit of a trajectory for being unsustainable, expensive, inefficient, not overly safe in a lot of respects. And I think data will revolutionise that. And
so in what ways is data going to revolutionise healthcare? Like, give me some sort of practical examples.
I think the predictability of how we're going to predict patient outcomes. If a patient comes in, we'll be able to predict when they're going to crash or have a complication and then prevent it before it actually happens.
And your business, what are you doing to try to solve that problem?
I mean, so we're taking data and we're really trying to put the patient at the centre of the transaction. And so data at the moment is often sold without the patient's consent. And so we take our consent engine, takes the patient's consent, lists it on a marketplace, and then technology providers or research institutions can purchase that data, and then the patient receives a portion of that data back into their bank account. And so up until now, patients were really not even privy to the fact that the data is being sold. And so we're empowering patients.
Awesome. I mean, overall, consumers, patients, citizens, we're all entering this new world where we're starting to understand we've got this data or data footprint that we leave around us, yet we don't really understand where it is. It's a classic problem. If I asked you, how much money do you have, and how much debt do you owe, most people could be able to flip open their phone, and in a few clicks they could say, well, I have this much in my savings account, my checking account, this is my home loan. But if I said the same thing to you about data, what's your footprint, who's using it, how are you using it? There's no app you can open. You don't have the same transparency. Is your vision to move to that world where people with their health data have that sort of transparency, that control, and it's being used to obviously improve their health and the health of society?
Yeah, I think it's really important to have a single source of truth for all of your health information. In medicine, every time you see a doctor, essentially your medical record changes because they'll make an adjustment, they'll add something, and the previous record's not really relevant. So I think having one place where you can keep your information is really, really valuable. Yeah.
Okay. And what are you worried about around digital health?
Look, I don't want to point the finger at any organisations, but I think that perhaps some of the larger bodies that are involved are a bit slow to innovate. Australia very much punches above its weight on the world stage in terms of digital health. Mm-hmm. Graham Greaves down in Melbourne invented FHIR, the Fast Healthcare Interoperability Resources. That's a world-leading piece of code that's used in conjunction with HL7, but our National Health Project doesn't even use that. My Health Record doesn't use the FHIR standard, and so that's just one example of where we have potential to have really great talent, but it's probably not been translated into daily clinical practice.
Right. So it's sort of existing ways of doing things and existing sort of entrenched bureaucracies, as it were, may put up barriers to actually the adoption of some of the digital health aspirations that you see as essential to building a better digital future.
Yeah. I mean, it's like the saying: if you always do the things you've always done, you'll always get what you've always got. And yeah, I think some of the organisations, I won't name them, but they need to be more open to innovation in healthcare. The fax machine is another classic example. Why in 2019 are we still using fax machines? They're regularly sent to the wrong address. They don't integrate very well into practice software, let alone the deep insights you can get from looking at the data. So, look, I think there's an enormous opportunity with digital health, but we've got a long way to go.
Terrific. And so that was kind of a general run. Anything else you'd like to add?
There's one other thing. I think the other thing that digital health is going to do, I mean, we talk about AI taking everybody's jobs, and that's always a very popular conversation to have. But I think in healthcare, what it's going to do is make the system far more efficient, and I think that's really, really important. You speak to any junior doctor in their first few years out of medical school, the vast majority of their time is spent rewriting prescriptions manually from one to the other, or transcribing lists of people's problems. like the clerical burden on a junior doctor is probably the majority of their time, and you sort of go through 6 years of medical school to sit there and be basically being a secretary. And so I think technology and digital health is going to accelerate that stuff being taken care of by itself and allow them to care for the patients better. And I think that's really powerful.
Terrific. So what are you going to be talking about at CeBIT?
Yeah, so there's a blockchain session. We've got some really great industry leaders. There's Luke from Escavox. They're a produce tracking company that goes basically from farm to fork, tracking it on blockchain. There's Adrian from Independent Reserve, one of Australia's leading exchanges. And I'm going to be speaking about sort of health use cases for blockchain. It's going to be a deep dive session afterwards. I'm going to be looking at 5 key use cases, and so people who are already involved in medicine can come along and we can try and talk about how to bring it to their practice.
Terrific. Thank you.